Okay, good morning.
Good morning, ma'am.
Okay, let us start with
Morning.
yes, good morning. So, hinot pwede mag-start. Dayon. So, aman iyo plano in one group, magpe-present ka tanan or one topic at a time.
Tigda na lang naman.
Sige. Hala. Hinot mauna.
One group of the time na lada ma'am kay para mas malaki.
Sige. So, we'll start with levels of evidence. Malaksi man levels of evidence. Sige. Sino't mauna? So, napira ka madto in a group? Tulo-tulo. Sige, start na kita.
Bisa na naman may pagkasunod-sunod.
What do you mean?
Like it ma-present.
Kung hinula itong mga volunteer pag-present yan so mas start yan levels of conference. Sa rin pa ni Villarino, okay lang kung one topic at a time. So all of the group will present in levels of evidence. And then after that, matima nga ni the two instruments that we're comparing the two instruments, and then the last one will be informed consent.
Okay.
Sige.
Kami na lang, ma'am.
Sige. Hinutin mo ka group.
Penyalo sa mamunugas.
Kamagyan, Peñalosa nga hi.
Lost ka na.
Aloste. Sige.
Nakikita na, ma'am.
Waray pa. Black at nakikitan pa. Ano eh?
Ito, ma'am.
Yes.
Okay. So, good morning, everyone. So, the first activity, we are instructed to search for evidences about an intervention from electronic medical databases. Tapos, igarang kaya based on the 5 levels, hankoan, bagat levels of evidence. Tapos, ang akong ginpili dili na topic is about joint mobilization for patients with with adhesive capsulitis. So ang first level of evidence kay ang highest level, which is level 1 kay amod to an systematic reviews and randomized control. So amo din amon, which is a systematic review entitled The Effectiveness of Joint Mobilization Techniques for Range of Motion in Adult Patients with Primary Adhesive Capsulitis of the Shoulder, a systematic review and meta-analysis. So haya title pala adanaan koan. So adanan ko na niya na level. So amadiyaan amon na bilang na paper. So medyo labay. Next naman, ang level 2 naman kay a controlled cohort study. So, adhesive capsulitis and dynamic splinting, a controlled cohort study. Inihiya na paper. Direlay, and doon niya title is about dynamic splinting, ang nakabutang. Ang iya kasi content hindi kay bagat gin-compare nera ang mga methods para para rehabilitation ng patients na may adhesive capsulitis. So amad ton may da physical therapy interventions like ang mga joint mobilization, tapos may da man abas may da amad ton may splinting. Tapos yes, so amad controlled. Tapos ang third level naman namon kay a retrospective cohort study, di nga interventions associated with an increased or decreased likelihood of pain reduction and improved function in patients with adhesive capsulitis, a retrospective cohort study. And fourth, kay multiple subject case report on end range mobilization techniques in adhesive capsulitis of the shoulder joint, a multiple subject case report. Tapos, and last namon, ang level 5, amo diya nga immediate effects of angular joint mobilization, a new concept of joint mobilization and pain range of motion, a disability na patient with shoulder adhesive capsulitis, a case report. So, pareho sa case report pero bagat lower adihiya kay bagat osala nga patient or osala nga subject na niya ginfofokusan, kumbaga bagat gorogotit iya scope compared hadi nga usa nga dorodaman nga subject. That's why horota sa detail level. So yes.
Okay, thank you. So next. Thank you so much.
Ma'am, kami po ang kada.
Okay.
Mike. Ano pag share screen niyo? Ari. Nag-mute. Kuan ba? Google Meet. Oh. Kaya na yun. Nakikita na screen mo?
Yes.
Senator study. So, good morning, classmates. Good morning, ma'am. We are here to present our...
Ane Villarino, pira ka mo? Villarino ka mo?
Ikuan, ma'am. Igo Mandresa Imperial. Pas ako, Villarino.
Okay.
So, anamon study po sampang kitang nag-assignment kita. Ayun pala yun. Ba yun? Yun din naman yung siyang study. Ano yung stop sharing lang kadali. Di ba intend ko tayo? Aliman. Okay. Ma-share screen na to.
Naiko ko no. Dili ko rai phone ko na ito. Ha? Iray ko phone na ito. Wait,
Ingan share screen din na share screen nga.
naiko kay ya na ko ya may.
So good morning class, good morning mama. Anamon po studying nga nakita as is ADHD in the classroom kung ano ng mga effective nga intervention strategies. So amon ini again rank according kung hainit pinaka effective nga intervention. So according amon thorough nga research, anamon nakita nga most effective ma'am is homeschool communication program since ay tiba ma'am nga may ADHD na may difficulty man ma'am in other situations. So at least ma'am
Wala daya yung ko.
kung nimonderan homeschool treatment strategy o maging comfortable iton patient since
Ano ya balay waray.
since waray ibang
Tao or
tao nga
pagkapanti atin.
o gubati mga ka-distract tayo. So fun amalad tamam.
So this is a systematic review.
Yes ma'am, systematic review of the effective interventions of ADHD and coping with the ADHD in classrooms.
Okay, good. Sige, next level.
Next level pa din. So next level ma'am is academic intervention. So despite the fact that stimulant medication and behavioral therapies often result in considerable reductions in ADHD symptoms.
Is this still an ADHD kuan? Tawag ito, article?
Yes ma'am.
You don't need to discuss the article. You just need to
Ko nagimo ini. Ako kundi report ko
So,
nagimo.
you just need to determine if this article is level 1, level 2, level 3, level 4 of evidence. Yun lang. Simple as that. You don't need to present.
level ano to?
Oh. You don't need to present. Mandres sa Maringasa. Yan lang pag-discuss. Sige na. Sunod nga level 2 niyo, cohort. May ni example ang cohort.
Yes, waray ko. Sunod po to.
Anay mo.
Yung paano na ito. Kaya pag-search. Ay, gino ito mo.
Wait.
Ano ito? Subject?
Level 4 ma'am. Level 4 ulit ang ito.
Para mga basa. Para mga basa.
Ano, may kay masunod kita nga group.
May damam. Si ma'am, next na lang ma'am.
Nag-save ka naman pag understand ng triangle. Ano mo na butang. An bagat an example na mamahan. An karan ADHD. Waray namon kabisan. Kasunod-sunod ang level. Okay, sobra 5 an amon na butang 7 and then 6.
So, per level, 6 ani yung article lang ginkuha.
Ano?
Anak ko lang to, you have to look for an article nga maka-distinguish ka mo nga in HIA, it is in level 1, level 2,
Level 1, level 2, level 3.
Oo, madali la. Madali la pamiling articles. Ako lang, at least mabaro ka mo. So, sige,
Pero-
sunod lang eh. Oo, ano man.
Pero ma'am, according kung on the understanding ma'am, kuan niya, level 4 ma'am, since ang amon study nga na kita is descriptive ya.
Descriptive. Kasi ito nga mo ADHD, bagahiyahin, they're trying to compare, actually they're trying to compare all of the strategies or the treatment strategies, di ba? And
Yes,
they
ma'am.
look for the best. So I don't think that's the lower level. Pero ano yan, participants?
Kuan po ma'am. $20 po ma'am.
Nakamute ka mo.
Oh yes, 20. Tapos, nag-ano man hira. So, okay, determine na ito ka. Next lang na kita nga kuhan. Kita at niyan maupay
Oh, di na po, ma'am.
11.
Adi na ma'am, may answer na po ma'am.
Sige.
Bagan, ang mga participants ma'am, ginassign ni rahin 5 po ka types of classwork para makita po ma'am kung hain nira lamang
Pahinara na Excel.
naira na Excel po.
Okay, tapos, sunod. Bagay na yun,
Tapos-
experimental.
Yes ma'am, implemental.
Experimental.
Experimental ngayon.
Hahain ka nga course. Karinit ni mo. Ano, damot ti assignment, nalilipong na ka mo.
Lalo-lalo na.
Kamamatag po ma'am.
Actually, ini nga labas sa preference, masayon lang. Kukuha mo lang. Mamibiling kalahin article nga, ma-match ito nga level of evidence. Yun lang. Tapos ang sunod niyo, yung cohorts. If it's experimental, okay, sige, go. Okay, it's cohort niyo. Example yung cohort study. May da.
Pare ma'am, next lang next.
Amo na. Next na lagi anay kami. Sige, ang Kilona. Kabentan.
Kiliano, ma'am.
Angkiliano, sorry. Makabentan Tenchera. Sige, go.
Ano yun?
Nakikita, ma'am?
Yes. Pag waray pa man, waray pa. Nakikita ko try to
na-share.
i-share. Oh, na-share screen ka na pero waray pa man dida. Sige.
Oh, good morning, ma'am. Good morning, classmates. So first is level 1, which is the systematic reviews and randomized control trials. An amon na anak ko nakita, ma'am, kay physical therapy for tendinopathy, an umbrella review of systematic reviews and meta-analysis. Since it pinaka-highest na level, ma'am, kay systematic reviews, randomized control trials, tapos meta-analysis. Pero haera na tulo, an bagat mas pinakahatas kay an meta-analysis. So, aminin naman na pili na case. Tas ginkuha namon ha PubMed. Ang sunod liwat, ma'am, kay level 2, which is the cohort studies, an amon case kay 20 years follow-up study comparing operative versus non-operative treatment of anterior cruciate ligament ruptures in high-level athletes. Since it cohort study kay longitudinal study man niya, so amay ito nga 20 years, like din pa-follow natin kung na ano an imo patient after aniya incident. Tapos, ang sunod kay level 3, case-controlled studies, effects of rotator cuff pathology and physical therapy on in vivo shoulder motion and clinical outcomes in patients with asymptomatic full-thickness rotator cuff tear. So, ito yan ang napili kay case-controlled man.
Ito nga kayo case man ka dakwa daw ay itiyadik nakakabasa ang tawag ito. Yan. Okay. Tapos sunod, ang pinaka-last.
Ang last naman kay case study or an case report na muscle relaxants for non-specific low back pain since amot pinakahamubo na level of evidence kay diri pa hiya bagat report lahiya need pa yan further study like para maging highest tiya like maging randomized control trial.
So in this case, series or case study ng muscle relaxant, so ano ang mga participant ni ka na kasing ka mga case series line or case study la? So far, nakabutang patients. Okay, so anyway, introduction pa man ito. That's ano man an era study, nagano man, usa lang nga tawo ni gin study hini?
Yes, ma'am, and may dala low back pain.
Usala.
Oo.
Okay, sige. Thank you. Thank you so much. Next. Era managbanag, Kasilan ng Rosales.
Yes, ma'am. Wait lang.
Okay, hiyat masunod ha era. Hindi managbanag.
Wala pa. Wala. Ang ma'am, pwede lang sa internet, ma'am. Moody alternative.
Okay, sige. The rest? Yun yung pwede. How about Rabatan, Parehas, Verso?
Okay, ma'am. Ma-share na po kami.
Asya na ito kanina grupo. Batan, Parehas nga Verso? Ralph?
Ibala po, ma'am, and Verso.
Ibala po, ma'am.
O yun naman mo, Ralph, ano ito, kagrupo?
Ako po, ma'am, Parehas, Labarda, Laharangan, Vergara. Kenny po man na sobra, wala na good.
So, Labarda, Lahara. Mula upat ka mo.
And Vergara po.
Damo man ka mo. Sige, hala.
Okay, ma'am. Wait lang, ma'am.
Sige. Kamo Floral, paahiray no kamo.
Koan, ma'am, Phoebe, tapos AJ. After na lang kami, ma'am, ni Raral.
Okay. Sige.
Thank you.
So, adian amon mga studies or mga article na levels of evidence. So, anamon level 1 kay on level 1 kay ang systematic review and randomized control trials. Asya niya namon article entitled adi nga mechanical assisted Walking with body weight support results in more independent walking than assisted overground walking in non-ambulatory patient early after stroke. So, usahay niya nga systematic review. Tapos namon level 2 liwat kay an amon article cohort studies kay entitled liwat hiya nga effects of a 4-week self-ankle mobilization with movement intervention on ankle passive range of motion. Balance, gait, and activities of daily living patient with chronic stroke. So, iniliwat hiya kay usaya nga kuan randomized controlled study. So, an amon liwat level 3 kay an case controlled study.
Anay parehas. Balik cohort study. So, this is a RCT, right? So, RCT is in level 5. Oh, level 1. Sorry, level 1. So, this is an RCT, right? So, conduct lahirahin. Level 2. Next level 2, aniyo. No, next level. Nato pa.
Awan cohort study.
Yes. And cohort study in level 2 kasi ni RCT. So, it should be
level 1.
Level 1. Kasi so far, nakabutang kasi didi.
Randomized.
Oo. Sida, urubos pa. Makita ko't era kuan. Itira abstract. Ito yung level 2. So far. Okay. So there are 2 groups as well. 5 times a week for 6 weeks. Okay, for 6 weeks. And then, sige daw. Yes, this is RCT. So
Under your level 1, ma'am?
Yes, level 1. So, sige, move to the next na lang, level 3.
Okay po. So, anamon level 3 kay an case controlled studies. Maliwat iniya nga a case control study of a serum level of a potential biomarkers in male breast cancer patients. So, kaniniyan may mga breast cancer among men. So, ang mga lalaki. So, an namon last case and level 4 kay an case series liwat ini manage and kuan liwat niya tayo namon article kay management of a severe neonatal respiratory distress due to the vertical transmission of a severe acute respiratory syndrome coronavirus 2. So, kuan liwat niya case report na under ya case series.
Okay, good. 4. Yun lang, and cohort na lahat yung bilingon. Sige ha? So, okay na diba? The rest are okay. Sige, thank you. So, next, Inverso, Ramas, ng de Miguelio.
Nakita na, ma'am? Ako on screen.
And then, na-load pa. Di na.
Okay. So, an amon topic, ma'am, is frozen shoulder interventions. And ang pinaka-first namon is systematic reviews, tapos itong meta-analysis. So, kunin hiya nga, ni pinakaitasin niya, ma'am, na level of evidence kay gin-combine hiya na systematic review, tas na-estimate pa yan effect of the literature, tas gin-determine pa niyan effectiveness of intervention. So, as ito pinakahitaas yan na level of evidence. And second is the cohort studies. So, cohort studies niya, ma'am, because long ito ng observation in hiya of the study. So, ginpa-follow niyan mga participants for a certain period of time, gina-observe ra. So, according to the journal, this prospective clinical study was conducted in a tertiary care center between August 2016 and August 2018. So, baga nakakita-kita didahan, duration han pag-observe haera. So, yes. So, moving on, ma'am, is we have the case-controlled studies, which is an ikatulo. So, different niya, ma'am, from cohort studies since inihiya retrospective observational study. Tapos, na-compare lahiya between a group that has an existing disease as an usana group na waray. So, next is we have the case series. So, any nga case series, ma'am, is gina-observe la niya and gina-identify la niya of a particular individual with frozen shoulder. So, usa lang niya or like a few people lang niya. So, oh yes, so siya ito. Kutila yung number of people. Anyway,
Okay, so pakibalik daw niyo yung level level 3.
level
Inihiya. Activity versus structure-oriented treatment approach for shoulder or for frozen shoulder. So this is an RCT. Kanang nahinabok with consumer. Nahinabok RCT in compare niya and long-term effects of structural oriented with activity oriented. So there are subjects as well. And then this is a RCT. So this is a level 1 evidence. So you need to figure out another or give an example of a level 3 case control. Okay? So, sige, ito na lang. I'm not your problem. Thank you so much.
Pinakalas, ma'am, is adihiya no ko ni case-based reasoning or expert opinion. So, from the word itself, expert opinion lang hiya, ma'am. So, diri hiya ano. Dito. Maray, opinion ko na talaga hiya. So, asya lapat dun, ma'am.
Okay, ini nga opinion ba may mga basis liwat hera? Wala nakabutang mga basis ng mga articles.
Kung ano, ma'am, adi, ma'am po. Ano siya din. Bagan iya lagi di-define, ma'am, like classification, and bagalayan case study.
It's actually a summary or say, oo.
Siya po yung convey niya, ma'am, case-based reasoning, expert opinion.
Hindi rin, kasi in hiya, baga na naghimo yung libro. If you may notice, may naghimo na yung libro. Actually, ito nga mga numbers nga nakikita mo nga may mga letter, may mga words, tas may mga numbers, those are the references niya. So nakikita nimo may mga references siya. So diri mo niya masisiring nga this is based on opinion. Kasi may niya tawag ito supporting evidences based on niya ang ginhimo nga summary ini nga particular case. Anyway, sige. Thank you. So mabalik kita kanda Villarino. Okay na ka mo Villarino?
Ma'am, mabawin na lang kami sunod, ma'am, nga activity and second.
Kaya wala talaga kami.
No, kung madali mo lang pag-search ng article. Okay, sige, bahala ka mo. So, on level 3 na yan.
Ma'am?
Yes. Banag-banag, okay na ka mo?
Okay na, ma'am.
Sige.
Sige, wait lang. Screen share na, ma'am. Hello?
So far, waray pa ako nakakikita. Waray paghapon.
Alright.
Waray pa.
Wait. Why won't you allow? Tapos, wait lang, ma'am. Next lang sa, hindi man siya mas screen share, ma'am.
Okay, so, hiyat mas malak sa iyo't internet sa iyo grupo. Francesca, right? About Rosales, Kasila, Mauro Hinay, tira ko.
Wait lang, ma'am. Try ko lang, ma'am.
Okay, sige.
Nakikita na, ma'am.
Okay, ano yan, na-load pa. Di na. Hindi na.
Hello. So, for the first, ma'am, for our first case, systemic review and randomized control trials and meta-analysis. So, the title is Effectiveness of Virtual Reality in Children and Young Adults with Cerebral Palsy, a systemic review of randomized control trial. So, title pa lang, ano na siya, ng systemic review. Ang systemic review, comprehensive review of the medical literature na they use explicit methods of systemic na pag-search, pag-identify, at pag-appraise ng mga literature. So, next na Jacob. Jacob? Hello? Oh, Jacob.
Hello,
Hello?
next na.
Okay,
Oh,
Hannah.
okay. Sorry. We have a communication barrier. So, pagyayo na lang po, paki-next na lang Jacob kay lag kaayo. So, we have cohort studies. So, the title, prospective controlled cohort study to evaluate changes of function, activity, and participation in patients with bilateral spastic cerebral palsy after robot-enhanced repetitive treadmill therapy. So, title, from the title itself, it already mentioned that it is a cohort study, but for more information, cohort study, it is a type of longitudinal observational study. So, in this kind of study, the individuals with a risk factor or exposure are followed over time. So, parang ino-observe talaga sila, like, for example, a duration of 10 years to really see the effects of of the study to the improvement of the patient. So, next, Jacob, for the third level, case-controlled studies. So, the title is Risk Factors for Cerebral Palsy, a case control study in Greece. So, ang title pa lang, naka-mention na siya o case control study. So, for the fourth is case series. The title is the etiologic yield cerebral palsy, a contemporary case series. So, case series are more on like descriptive, and from the title itself, it already mentioned that it is a case series. So, that's all, ma'am. Hello? Hello?
Yes, yes, yes. I heard you. Okay, that's good. That's good. Okay, so okay na. Okay na ka mo. Okay, parehas. You're welcome. Parehas, an EU cohort. Nakabiling ka ng cohort. Pareha. How about Hera Villarino? Ano na ka mo?
Ma'am, present kami, ma'am.
Okay, so ready na kamo yan na, diri kay mabalik lang na kami kanda Peñalosa.
Ready na, ma'am. Ready.
O, sige.
Go on po na lito. Ma'am, natadaan po, ma'am, nga cohort study, ma'am, kay balik ta dada. Kasukal ko na line camera ini nga ipad. Adi, ma'am, nga tap pre. Ikaw tap tripod. Ito, ma'am, nga explaining nga background ni Adi. Ito, ma'am, nga retrospective cohort study in the substroke. Ano, yakoy nagpag-close ni. Ato, since title pala, ma'am, naka-state yung cohort and na kuan niya ito nakafocus siya ma'am long-term benefits ma'am. So meaning na-conduct po ini nga study na long period of time para makita po kung ano po ang mopay po nga treatment hit diabetes mellitus Taiwan. Tapos case control po ma'am. Sunod lanay. Ang cross-sectional po ma'am, adi po nga study, ang cross-sectional study of prevalence of dementia, behavioral symptoms, mobility, pain, and other health parameters in nursing homes in Austria. Since ang pag data gathering po ni ma'am, kung compare po ang different types of multiple intelligences ang mga respondents. Tapos, malapad to ma'am.
Ano to iya? Ang last? Ano niya level?
Level
Case series? Case control?
cross-sectional po ma'am.
Kasi wala pa kita na cross-sectional. Di pa ko magud maaram case. Maaram ako may maaram yung cross-sectional. Pero under here, what level?
Level 3 ada ma'am.
Kaya naman nag-level 3 hiya. Case control. May ka mo case series?
Case series.
Or case study.
Medyo kita. Medyo po ma'am, adi po mga study ma'am. Ang case series po ang gastrointestinal tuberculosis ma'am.
Okay, so balikan na natin ang iyo ko ang level 3, ang case control study. Kaya nakasiring ka mo case control study at hiya. Ano yun kanina nga cross-sectional study.
Nakasiring po kami ma'am nga case control study ni kay ang pag data gathering po ini nag-focus po different types of multiple intelligences po ang mga respondents nga para makita nila behavior in different types of aspects ma'am.
Okay, is this a retrospective or prospective type of study or where they conduct? Kasi ang case control, ang pag-difference sa niyo case control nga niyo cohort study. Kasi ang case control is may dana niya condition ang mga tao. Simpikitan.
Yes,
inihira is they're trying to know the behavior pala, di ba?
Yes, ma'am.
Behavioral man niya. Ano man niya, pakikuan mo nakita, symptoms, prevalence. Kasi yung prevalence is gaano ka, when you say prevalence, gaano hiya ka damo. Ano ka damo in usa ka nursing home, ano ka damo in may dementia, may behavioral symptoms, may mobility pain. Amo talagang kukuha.
Yes, ma'am.
Okay. So, sige. Kaya naman niyo pa kasi rin ako cross-sectional study of prevention of dementia, naging case control here.
Naging case control, ma'am?
Sige, padayon.
Naging, para po mo, naging case control po iniya kay nakita po man different outcomes sa dementia. Tapos gin-compare po ini nga tanan. To come up kung ano talaga ang napapakita nila nga symptoms ng dementia.
So are they also trying to correlate and dementia with the behavioral symptoms of mobility pain. Kasi ang prevalence of dementia, they're trying to know how peraan may dementia nursing home. Does it related ba ang behavioral symptoms, mobility pain, ngatuan, or other health problems sa dementia? Amo taring kikita.
Yes,
Are you saying that if the patient have dementia, may na niya mga behavioral symptoms, mobility pain, and other health parameters?
Yes, ma'am. Oo.
Okay. Sige ba? Sige, pero di ako sure pa. Di ako sure kasi this is a more prevalence lang. Pero di rin kita maaram kung if it is all are. Pero man ang dementia, how many percent din ang era kuan? An era study, pero an era nakuha na made a percentage.
7 kuan ma'am, sa Austria po ma'am 85.2 tapos sa Czech Republic 53%.
Okay, sige. Hala. And how about kanda, okay, thank you. How about kanda
Sige,
batan, parehas, may cohort na kamo, and also inverso, ayo case
May
control.
dana, ma'am.
Sige, let me see.
So, siya ito naman nakita nga usa nga cohort study, a prospective cohort study on an effect of balance training program including calf muscle strengthening in a community dwelling older adults. Tapos siya niya ma'am background or abstract. Then tapos mga to.
Okay, Natia. Okay, thank you.
Okay,
How about
thank you, ma'am.
how about inverso? Do you have the case control study? Ay, kung waray pa, okay, babalikan ta kamo niyan. So, we'll go back to the first group. Kiskisan, Peñalosa, Loste. Okay, present na lang kamo ang ato next nga assignment. Comparing two instruments for the reliability and validity.
Share screen. So, ma'am, present na po ako. Ang akong pugin kuha na measurements is for balance and endurance for community-based older adults and dynamic gait index ng 6-minute walk test. First is an 6 minutes walk test is excellent for test retest submaximal exercise used to assess walking endurance and aerobic capacity. Tapos, dynamic gait index is excellently what for assessing likelihood of falling in older adults. Kaya pero pwede gyapon niya pag-assess hit gait analysis niya bagat pagkuan pareho sa endurance so dito for and 6 minutes walk test is good for community dwelling elderly with a heart and lung and other health problems. Tapos ang dynamic gait index luwat is for vestibular and balance problems and those at risk of falls. Tapos, ang criterion validity is can be used to obtain reliability and valid measures of physical endurance in older adults and that moderately reflects overall physical functional performance. Tapos sa dynamic gait index liwat is valid indicator of functional gait abilities for people with balance and vestibular or disorder. So bagat an construct validity kay an 6 minutes 6 minutes walk test. Tapos ma'am an ako yung pili na bagat measurement is 6-minute walk test. Kay like, if 6-minute walk test kasi ma'am, pwede habisan hain na health problems ko, pwede mo yan ma-measure. Pwede mo gyap yan ma-measure ito mo vestibular or balance problems gyap di dia iya kay like makita ka man ito or kung like it kalakat hit patient may vestibular problems or balance problems nga mas easy hiyangan simple na pag cover hit 6-minute walk walking. So bagat mas maupahiya kaysa dynamic index test.
So in terms of practicality and in terms of if you have time constraint, so okay, mas malaki yung 6 minutes walk test. Kaya mo dynamic gait index damo niya mga subsets, di ba? Mga subsets. So mas more pa 6 minutes walk test. Anyway, sige, depende mo itong imo, try to measure, which is balance and endurance for community-based older adults. So any additional information? Marina?
Okay naman.
Okay, say thank you. Okay. Villarino, ano yung group? May dakamuhan. Okay, sige.
Ano na po, ma'am?
And next natin nga assignment. May dana mo?
Ma'am, second dala po kami ma-present, ma'am.
Sige. Next nga group, Hirama Kabenta. Kamo. Tenchera. Angkiliano.
Wait lang, mama. Ito pa kung kaya dyan pag-share screen.
Okay, sige.
Hello? Ma'am, anay lakay kay zinawawara. Di rin habatun.
Sige, next lang na kita. Next. Okay. So, Kasila, Managbanag, Rosales. Okay lang, Rosales.
Ma'am, pwede kami lanay.
Sige, Batan. Sige.
Okay.
Ay, ma'am, ako person. Okay. So these are the instruments with arthritis by assessing their hand mobility. So there are two instruments. So animo Durus hand index kanimo arthritis hand function test. So an area of assessment animo ADLs, Durus hand index, ADLs, coordination, dexterity, functional mobility, general health, life participation animo upper extremity function. Then your arthritis hand function test, animo ADLs, and functional mobility, animo dexterity. So itiya cost, Durus hand index is free, while animo arthritis hand function test is na cost $25. So age ranges 7 to 70 years old, while animo arthritis hand function test age ranges to 18 to 64. So ang time niya nga test is Durus hand index is 3 to 7 minutes, while animo arthritis hand function test is 20 to 30 minutes. So animo Durus hand index but may excellent retest reliability for patient with rheumatoid arthritis, while animo arthritis hand function test is excellent retest reliability for patient with osteoarthritis. Then animo excellent interator or interator reliability in 25 inpatient interviewed twice in 24-hour HIMO Durus hand index, while an DD is warahiya bagat HIMO arthritis hand function test warahiya bagat interator reliability. Anila may dan iya criterion validity which na adequate to excellent correlation with physical activities of daily living ranging. Well, animo nga di Durosan Index, and criterion validity is excellent correlation with the Scleroderma Functional Assessment Questionnaire. Well, and didilatan imo arthritis and function test warilat ko siya. So, anila may the SNIA construct validity, which is excellent to adequate correlation of arthritis hand function test with physical activities of daily living. Then, ang nasasalin na lang din mo Durosan Index, mo construct validity, which is excellent correlation between the DHI and Revels Functional Index or RFI. Then, mo content validity. Each item was correlated to a subgroup according to author's clinical experience. So, malad ma'am.
So, ano man yung pili din niya? Ano niya kuhan? Ano niyo focus din niya? Or ano yung gusto kuhaon? Or tawagin niya, ito condition na in a particular condition niyo gagamitan niya nga mga instruments? Niyo kuhan?
Arthritis, ma'am po.
Arthritis. So you're trying to get an instrument or use an instrument that is good for evaluation arthritis. So a specific arthritis kasi pwede man na din Durosan, can be more of an RA, diliwat sa could be more of a OA. Di matukurog signon nga, di rin na pwede nga tanan nga arthritis, di ba? So based on these two comparison, which of the two imo gagamiton?
Manim kwan hiya ma'am. Mo Durosan Index since kwan hiya abaga time efficient gihapon.
Nga in terms of area of assessment, mas damo na assess and also cost free. And damon validity study kasi may construct validity pa hiya, may criterion may pa niya content, validity, criterion validity. So sige, may nakaman explanation na boss. Ano ito?
Ang summary ito, ma'am.
Sige, gigakan.
Okay. According to the data we have collected, the Durosan Index is more cost-effective and time-efficient as well as more dependable and is highly recommended by professional for patient with arthritis. Durosan Index provides more information such as construct validity, test-retest reliability, inter-rater, and inter-rater reliability that may limit the activities of the hand. According to the reference given, ma'am, parang DHI may be better suited for patient with mild hand impairments rather than patient with severe hand contractures.
Okay. So they are better with mild hand impairment. So nadepende na lot ng iyo condition. Okay, sige. Thank you, Haniyo Group.
Thank you, ma'am.
Okay, so inverso ang group.
Ma'am, kami na naman. Next, ma'am.
Sige.
Ma'am, okay na kami. Nabuhin na kayo.
Anay. So, anay. So, Rosales ang nagmapresenta nito. So, nalaka mo ang Kiliano, okay?
Okay na, Jacob?
Ma'am, nakikita na, ma'am.
So far, ikaw tak nakikita pala ni Dee.
Wait lang.
Sige, try daw.
Yung internet, ma'am.
Patay. Ano, Jacob?
Maray pa. Ano? Okay, nakita ko na.
Good morning, ma'am. So, a specific context to measure and search for two instruments that would measure a specific context. So, the case that we used, ma'am, is stroke. So, the measure that we used are the four-square step test or the FSST and the multiple errands test. So, for their purpose, the FSST is a test of dynamic balance and coordination that clinically assesses the participant's ability to step over objects forward, sideways, and backwards while ang multiple errands kay it measures how the impairments in executive performance affect functioning in natural context like ang iya kang pag-understand sa instructions kung if naka-understand ba dayon siya. So for the areas of assessment, both are used for activities of daily living. While though I forgot to add in here, there are more areas of assessment for the Foursquare step test. For the cost, they're both can be done without any cost or for free, and the FSST has an excellent retest reliability for patients with stroke, and for the inter-rater or intra-rater reliability, FSST has excellent inter-rater and inter-rater reliability, while the multiple errands test has an excellent inter-rater reliability. So for criterion validity, the FSST has excellent correlation with another test with step test. So while ang multiple errands test for those with sa ng acute stroke, adequate correlation with the executive function performance test, while for chronic stroke, adequate correlation with the behavioral assessment of this executive syndrome battery. So for construct validity, the FSST shows close to significant correlation with a TUG score katong another test said. And for the multiple errands test, it also shows adequate construct validity of the MET-SV to differentiate participants with chronic stroke or traumatic brain injury from healthy participants. So in terms of internal consistency, the multiple errands test has an excellent internal consistency. So Jacob, next. Table. Hello. Oh my God, my internet. Hello. So oh my God.
Adi na.
Okay. Ano na. Sige. To continue ha. So in terms of time of both tests, the FSST is much better because it can be done in less than 5 minutes. Ang imo lang, like you instruct the patient move 5 steps backwards, 3 steps sidewards, like that. Whereas the multiple errands test to be able to formulate or to gather enough data, enough results, it would take time for about 60 minutes to be able to say that, oh, we've already gathered enough data that we can conclude that it is effective for the patient or whatever. So for the age ranges, they are quite similar. For children, for 6 to 12, adolescent 13 to 17, and for the adult 18 to 64, whereas for the elderly age 65 plus. So basically, for my recommendations, the FSST is recommended mostly for acute and chronic level patients with stroke, while the multiple errands test is recommended for stroke patients with chronic level, since those with acute stroke may be too medically fragile to participate in this assessment. And basically, it is better, the FSST is better in the way that this takes lesser time and is much more straightforward than the multiple errands test. It is also more effective since its simplicity of test used for patients with stroke, and it's easily understandable for the patient, like for the younger to the older patients. So that's all, ma'am. Thank you.
Okay, sige. Thank you so much. Angkiliano, niyo grupo? Yes, ma'am, Anay.
So, good morning, ma'am. So, ako niya na i-discuss kaya naman mga instruments nga measure for gait hit mga may ada spinal cord injury. So when amon ging compare is the 6-minute walk test ngan walking index for spinal cord injury. So the area of assessment kay hit 6-minute walk test kay aerobic capacity and gait. Tapos an walking index for spinal cord injury is functional mobility and gait. So it 6 MWT liwat kay excellent for inter-rater reliability for patients with spinal cord injury. While ano sa liwat is an excellent inter-rater reliability liwat gyapya. Walking index liwat kay excellent retest reliability for adult patient with spinal cord injury. It is also an excellent inter-rater reliability for patients with acute and chronic spinal cord injury. So according to research nga namon ging kita is 100% talaga hiya nga nakuan. So ang criterion validity for 6-minute walk test is it has an excellent correlation between 10-meter walk test and timed up and go. O sa liwat is excellent criterion validity lut niya is excellent correlation between functional independence measure and timed up and go. So the construct validity for 6-minute walk test is adequate correlation with spinal cord injury, functional ambulation profile. While on construct validity for whiskey liwat is excellent liwat hiya for between 10-meter walk test, 6-meter walk test, and timed up and go. So if igbabasehon liwat natin is an ERA cost, excuse me, 6-meter walk test is free, and same with whiskey liwat, free gihapya. So the time administered for 6-minute walk test is less than 6 minutes, while ano sa an whiskey liwat is 5 minutes. So the age range for 6-minute walk test is 2 to 65 years old, while an age range liwat han an whiskey is 13 to 65 years old. So based han amon outcome measure, amon research is mas preferred talaga it whiskey. Kay it specifically made for incomplete spinal cord injury talaga hiya. And it is proven to be content reliable, inter and intra-reliable, criterion validity, and concurrently valid. It is intended to assess ambulation with bracing, ambulation aids, variation in bracing, and physical assistance. So add-ons lagi hapneda is the 6-meter walk test is used for endurance. Pero if igbabasehan lang talaga is for spinal cord injury, for gait lang talaga, whiskey is much more reliable. There is no gold standard talaga. According to our researches, there's no gold standard talaga for spinal cord injury. So, it gagamit nga secondary outcome measure is the 6-minute walk test. Pero mas primary talaga is the whiskey because asya talaga iyaging focus for spinal cord injury unless it's 6-meter walk test outside of the scope talaga yan, like for adults, for brain injury. Pero at whiskey is made for spinal cord injury talaga, yeah. So that is all, ma'am.
Okay, thank you. Specific here. Okay, thank you so much. Okay, next.
Kami ma'am next.
Sige.
Ano pa ng concern?
Okay. Ang amon ma'am is napili nga test ma'am is an tentative performance-oriented mobility assessment tapos functional gait assessment. Inera nga do nga test, nag-focus kami pag-measuring gait in elderly and patients nga nagkaada in stroke. Pero inera nga test, pwede ka para gamiton sugad Parkinson's disease, pain management, mga rehabilitation. Pero ang amon ginfocusan is stroke only, ma'am. So, ang tentative performance-oriented mobility assessment, ma'am, ito yung test, ma'am, it is used to measure an older adult's gait and balance abilities. It is designed to measure including an fall risk and gait function in elderly, but has also been used for patients with various conditions. And tentative performance-oriented mobility test must mas na-focus lang yung elderly. Dire yan nagkukuhanin mga adolescents, mga young. Tapos, ito yan, ma'am. Ito yung area of assessment, balance, vestibular, and non-vestibular. Tapos gate. Ano yung assessment type? Hantinet is performance. Ginme-measure niya yung performance. Tapos ano yung cost is free. Tapos, time pag-administer iya, 10 to 15 minutes. And test retest reliability and tineti kay excellent iya test retest reliability for performance-oriented mobility. Tapos pag-assess ng POMA being and POMA G has stroke for older adults. Tapos niya inter-rater and intra-rater reliability excellent iya reliability for frail elders including 38.8% with stroke and 24.9% with Parkinson's disease. Kinupod na lang pero naman focus ma'am stroke lang ma'am na upod lang yung percentage. Tapos ano yung criterion validity, adequate correlation between POMA B and timed up and go 0.55. Tapos adequate correlation gap functional reach, walking speed, ngan excellent correlation, older adult resources and services. Tapos ang construct validity and kinetis, excellent POMA B gap and G. And then ma'am, ang functional gait assessment, ginagamit ang functional gait assessment to assess postural stability during walking and assess an individual's ability to perform multiple motor tasks while walking. Iniyang nga tool, modify the of the 8-item dynamic gait index developed to improve reliability and reduce ceiling effect. And assessment type, observer. And ang TP, ma-observe yan kan gait and patient, kung nakakakambayan ang normal nga ang pag-walk nga ni mamang gate. Tapos, cost-free bagat knowledge lang ang PT. Tapos, para stroke hiya, as I said kanina, pwede ka Parkinson's disease, tapos sa spinal cord injury, sa mga vestibular disorder. Ang time pag-assess functional gait assessment is 5 to 20 minutes. Tapos ages, pwede ages 8 to 64 years old, tapos 65 years old and above. Ang functional gait assessment, test retest reliability, excellent. Tapos inter-rater, excellent. Reliability with stroke. Tapos criterion validity, excellent correlation with 10 MWT and FAT. Tapos construct validity, excellent convergent validity with 10 WMT during first week of therapy, 2 months and 5 months after therapy. So based amon opinion ma'am, mas amon conclusion, based on data na ginpakita, gin-recommend namon ang functional gait assessment over antennae mobility test because antennae mobility test na only aim here pag-develop and measure and screen in older adults only nga nag-stroke for balance and gait, while ang functional gait assessment pwede in ages 8 to 64, 65 and above. So, ang scope and functional gait assessment mas dako like bisan ano nga ages amo asya namon gini-recommend ang functional gait assessment.
Okay, sige. Kung ano man iyo wait lang.
Pwede na pag-stop share screen. On pa.
Okay, sige. Thank you.
Okay na, ma'am?
Okay na to, okay na. So, depende man ton iyo kikita, iyo goal, iyo, what iyo conditions or patients. Okay, sige. And last one, hera inverso nga group. Yes. Kita na.
So, an amon po instruments that measure aerobic capacity for community dwelling individuals can so kini 6-minute walk test tapos for rating scale of perceived exertion. So, aniya test reliability
na-show na excellent test reliability for community-dwelling individuals and patients who are enrolled in inpatient rehab. Tapos sa Borg naman kay actually ngadtuhan hindsight ang nakabutang didto kay not reported in stroke pero one study la ang nagkuan na ang iya test reliability kay excellent tap na gin kuan man hiya like gin assess and Borg stroke patients during hankuan and 6-minute walk test tapos 12-minute walk test same subjects gihap tapos amo gihap high test reliability and lumawas tapos aniya naman inter-rater reliability 6-minute walk test kay adequate for patients enrolled in inpatient rehab. Tapos for criterion validity naman, 6-minute walk test kay excellent correlation with 2-minute walk test and 12-minute walk test. Tapos and Borg rating scale kay poor correlation between 6-minute walk test and 12-minute walk test.
Okay, so based on the two, ano man yung pili, Didi?
6-minute
walk. Explain more. Why?
Kay and actually ang nakabutang na dito kuan po hiya gold standard.
And 6-minute walk test in terms of measuring aerobic capacity for community dwelling individual. Asya na? Okay. So, pamati ko, mas maupay kumuha ka mo kasi board rating scale, simpani mo kanina, it was done after 6-minute or during a 6-minute walk test or 12-minute walk test. So, bali, mas mauro kayo, namiling ka mo mas better pan board rating scale. Iko-compare mo 6-minute walk test. Ano? Sige. Anyway. Thank you. So, next, balik kita. And first na group, pinaka-last na itong assignment. That would be the informed consent. Let us see. You informed consent. Okay, everybody should participate na lang. Kung may niyo comment, ito yung subject, ito yung classmates, ito yung represent. Kuya ni Kasilan, pabulpot pala. Okay. Kawara-wara ada. Sige. First group, Peñalosa, Kiskisan Loste, informed consent, may na?
Hiloste mamit na ako.
Nakikita ba, ma'am?
Nakikita. Pakidoda ko lang naman. Kamanik ng kita. Nabasa. Ikakakabasa good pa kay medyo.
Ito, ma'am.
Ayan o. Sugad-sugad ganman. Sige, thank you.
Good morning, ma'am. So, for tamang informed consent, contents kay na include title of study, which is comparing surgical repair with conservative treatment for degenerative rotator cuff tears. Next kay principal investigator, which it contents ini kay na itakon name and address and contact information. Moving on to the purpose of study is nakastate nga the participant is being asked to take part in a research study. Before they decide to participate in this study, it is important that they understand why the research is being done and what it will involve. So they are asked to read the information carefully and asked for clarifications or questions sa researcher if there's anything that is not clear or if they need more information. The purpose of this study is randomized control trial was to compare functional and radiologic improvement after surgical and conservative treatment of degenerative rotator cuff tears. For the study procedures, first, a questionnaire of 13 yes or no questions relating to the perception of symptoms of shoulder pain and function in the last 24 hours will be given to the participants. Then, mean and mean pain and disability during the last week will be measured using a visual analog scale. And lastly, the questionnaires will be kept secure, so the information that was given by the participant will be kept confidential. Next kay it risks and benefits it amon study. It risks include nga one, having heart attack or blood clot after surgery, persisting or recurring symptoms after surgery, and lastly, stiffness after surgery. It benefits naman kay na include their participation in this study may help aid future patients with degenerative rotator cuff tears. It will help future patients with their recovery and rehabilitation, and it will improve pain relief and function. For the confidentiality nga part, literal responses will be kept anonymous, pero if they have comments, it won't be kept anonymous. Every effort will be made by the researcher to preserve their confidentiality by assigning code names or numbers for participants that will be used on all the research notes and documents, as well as keeping notes, interview transcriptions, and any other identifying participant information in a locked file cabinet in the personal possession of the researcher. Participant data will be kept confidential except in cases where the researcher is legally obligated to report specific incidents. These include, but may not be limited to, incidents of abuse and suicide risk. For the contact information part, it will lead back to Ma'am Yutadi on contact information. However, if the participant is hesitant or if the participant is hesitant, they may contact this number instead na naka-provide. For the voluntary participation naman kay their participation in this study is voluntary and it is up to them to decide whether or not to take part in this study. If they decide to take part in this study, they will be asked to sign a consent form which will be shown later. After they sign the form, they are still free to withdraw anytime without giving a reason. Withdrawing from the study will not affect the relationship they already have with the researcher, and if they withdraw from the study before data collection is completed, their data will be returned or destroyed. So, amo unit contents tamon consent form, which states that I have read and I understand the provided information and have had the opportunity to ask questions. I understand that my participation is voluntary and that I am free to withdraw at any time without giving a reason and without cost. I understand that I will be given a copy of this consent form and I voluntarily agreed to take part in this study.
Okay, sige. Thank you. Ayun ay pagkuha ito ngayon mo yung percent. So, comment ko lang, so actually, what you're trying to say here is that what you're trying to present here is, kumbaga you're presenting of how will it be, what they call this, what will be the content of the subsets of the informed consent. Okay, so akong na gusto mahinabo is, akong gusto makitan is, it should be addressed to your soon-to-be participants. So, baga dili ka kumbaga, if you have noticed, ako ng example, hanuna, baka nakikik-istorya. Okay? So, or baga, ani mo participant, nagbabasa nga hiya itong address to that or address to him or to her. Itong participant. Kasi the way you address, hindi ako sa pakiigbaw daw, anay, the way you address is that medyo okay ang iba, pero ang katikangan, ang purpose of the study pala, ibalik kita ang purpose of the study. Ang purpose of the study pala, this is a general. Baga general, hindi i-address ito nga nagbabasa. So dapat specific nga. And also, before you decide to participate in the study, it's important you understand. Okay, again, okay, sige, nayakan naman ito. Pero gusto ko, the use of language, you should be understandable and very simple English. Kasi, anot nga aid? O, di ba? Bagat ano hiya, nakaintindi ba ito hiya? So, another also is the inigihapon na study procedure. Ito hera, dapat din more simplified. Okay, relating to perception of symptoms. Okay, perception of symptoms may not be understandable with the simple naton mga ibang mga tao. So dapat i-kuha mo pa ito, simple terms, more simpler terms pa ito ya. Ito, tawag ito. Pain and disability during the last week will be measured using. So, usag ito, you have to explain me the pain mahihinaboy ni. Okay, the use of question will be kept as secure to the information that was given to. Okay. Pwede na ito ya, sige. Actually, yun lang ang akong comment. The overall comment is dapat naka-address siya. Kumbaga, ang tawagin ni address ito usang nga tao nga nagbabasa. So, okay. And also, the use of language, simple English, as much as possible. And contact information, dapat, balik ka mong contact information nga di nga side, and contact information. So, okay, contact information, result of participation. So, you may contact the researcher. Okay, so, kurog singon di, saka na hiya kung may mga pakya na after han participation, han study, amot imulag, kailangan hiya to. But ang nagawas di, pwede ra magpakya na after na. How about now? How about now nga nagbabasa pala ng informed consent? Dapat may nakabutang. If you have any questions now or later, you can ask anytime. So at least makabutang ka mo nila. Kasi ba nakabutang nila is after na ngayon ang era study. What about kung di nakakaintindi ng informed consent? Di pwede magpakya na. So amit question ito no sa nga soon to be participant nimo. So, okay. So also, baka nangunguyab ini. Thank you. Thank you for that. Baka nangunguyab. So, iti mo the use of your language, sinay-hinay. Baga pleasing ba? Diri baga kind, iti mo pagyakan. Baga pleasing ba? Nangunguyab ka talaga. Nga, kailangan mo talagang participants. So, diri magamando nga kailangan ini sugadini, okay? So, dapat pleasing. Bagat something nga maingganyo hera. Okay? So, that's my comment lang. Pero, okay naman ang content. Pero, I mean, change lang nga. At least naman lang, maiingganyo ang mabasa. Okay? Tapos, dapat address ito nga tao na nagbabasa. So, baga, personalize mo hiya ginahatag. Okay? Amo ito paghimo of informed consent. Kasi, kumbaga, akong gudin ni, para gawin ha akon nga letter. Bagat sa dito. So, diri gud in general. Okay, thank you. And, kamo Villarino, anong iyo? Diyan na kamo? Mandresa, Imperial, go. Okay guys, if you have already informed consent, pakitalata akon.
Ma'am, present po kami, ma'am.
Bangin liwat kasi nagyakan ako masig uy diri nga na siya amo na pag-change ito kaya at least naman la nag-try ka mo tapos at least i-change natin lot later. Okay, sige Villarino.
Ma'am.
Yes, Rosales, yes. Yes.
Pwede kami anay, ma'am.
Okay lah iyo, Villarino.
Kami ano?
Sige, ma'am. Sige, ma'am.
Okay, sige. Sige, Rosales, go.
Wait lang. Makita na, ma'am.
Ano waray pa, call imo pa picture. Utra daw, utra la.
Ito rin ko lang. Ano nakikita?
Actually, waray, waray pa, na-loading pa. Waray pa. Otro daw la.
Sige, hanggang internet.
Sige. Hans, kamo na lang. Anay.
Okay, ma'am. Ito nga ito yung daw pasa. Ma'am, nakikita pa na screen mo?
Yes, adi na.
Okay, boss. Tadi po namon informed consent po. Anamon po research study nga na come up in mind is the implementation of moving walkways in multiple story establishments for persons with disability in Tacloban State. So, namon to purpose po, ma'am, ibagan i-invite po ang usa nga person with disability as a respondent po amon study. Tapos anamon po respondents will be 18 years old and older. Tapos ang purpose po di ma'am para po masabtan kon ang mga PWDs po kung paano pero maka-cope up in pagsakahin iba po nga floor sa iba-iba nga establishment po. Gamit ang moving walkway or moving pavement. So, ang procedure po, ma'am, first po, make sure po naman kung ma-agree po ang respondent or dairy before namin natagan yung survey questionnaire. And ang survey questionnaire po, ma'am, can be accomplished within 5 to 10 minutes. Ang risk po or discomforts, what if we anticipated discomfort for those na ma-contribute hitaton study. So, minimal na po ang risk kung may daman. So, ang respondent po may inform po in any new findings nga maka-affecting decision kung whether ma-contribute pa hamon study or dairy. So, ang benefits po ma'am amon research para hamon mga respondents is for them to have a new way to cope up with going up and down without the use of elevators and stairs. Tapos, with the confidentiality, ma'am, syempre, we have the law called the data privacy law. So, the data that they will share will only keep within the researchers and the other party. And it will not be disclosed to anybody. And they have the freedom to choose whether to withdraw ma'am itira pag-share or kung gusto nila mag-volunteer mas maupay po. Tapos nagbilin po kami ma'am in note nga if kung may puwera mga questions pwede puwera mag-chat mga researchers po. Tapos may da po kami inbutang po nga bagan form po nga isa-sign before hira proceed ay pag data gathering po para for awareness po ma'am and para dirigya para ma-install to amala po ma'am.
Okay, so pakibalik ka Origbola magamay.
Ready po ma'am.
Sige. You may discuss this with those that will give this questionnaire. Kung itong aforemention kasi aforemention is very understandable ng mga tao.
Okay.
Tapos an opt niyo nga word you can use the choose. You may choose kasi mas malaksi and choose maintindihan.
Yes.
Benefits of. Okay, in terms of your risk, ano't nga minimal risk?
Anamon po risk ma'am ang discomfort la po ang patient nga bangin mag-fight pa malang iya.
Kasi balik daw ni risk and benefits of risk and discomfort daw. there's no anticipated discomfort for those contributing to the study, so risk to participants minimal. You'll be informed about any new finding may affect the decision to remain in study. So basically, the participants will just answer the question, correct?
Yes, ma'am.
So if you were going to use if you were to say minimal, you need to explain more kung ano niya minimal risk. Oh, you have to explain more kung ano niya nga minimal risk sa your patient, sa your participants. At na minimal. So kung nasa rin ka nga ba niya maawod, so it could be. It could
Yes,
be.
po.
Bubutang niyo to dida. Okay, so far naintindihan man ibang words, pero an opt lang baga diya common nga English.
Oh, yes, ma'am.
Makukuha nito mo mga aforementioned na hiton pag pinanguan. Although you can use but very good and although mga but na lang. BUT. Mas maintindihan pa ito niyo mga tao. Okay,
Yes,
so yun lang. Mula ito takon so far okay. Waray benefit waray niyo sinisiring nga panhatag ini.
May na po, ma'am. Waray lang po nam ka state po nga ni.
Ano man yung gusto hatag, pero kay danay dilitera na mas mapit waray. Ati yung baga waray may pa snack, may waray.
May na po, ma'am, pa snack, pero
Diri may mention.
pero dire
So,
po
mas-
na may mention, ma'am.
Oh, actually which is good kasi magbabayas lugod. So pwede
Yes.
ka maghatag after nila question pwede ka maghatag yung pa snack.
Yes po. Yes, ma'am.
Okay, sige. Thank you.
Thank you, ma'am.
Okay, next and Anguiano, Makabenta, Tunchera, may dana niyo.
Yes, ma'am.
Sige.
Okay. Nakikita, ma'am?
O, iguan laan iya. Do na wala. Ayun.
Okay.
Sige.
So, informed consent form, research title, Let's Get Physical. Wow. A study on the impact of exercise and vices and its effect on overweight individuals. So, purpose and conduct of the study, di naton i-include natin diyan information general nature of what is to take place. So the study will deal and determine the impact of exercise and vices and its effect on overweight individuals. Tapos, may kapil tagyap ang duration, which is, meaning undergo a 5-week duration of selected exercise and training administered by physical therapists. Participants' information. The respondent decides to voluntarily participate in assessments and treatments given by the physical therapist. So, di naton bagat na-emphasize nga voluntary ini nga pag-participate. Yeah. Tapos, na-include tagyap nga questionnaire and ma-undergo health and exercise training. Tapos, gihap i-ensure ta nga it data nga mako-collect ti ka nga era will be handled with respect and in a professional manner by the researchers. Next, risk and inconveniences. Respondents understands that there are very small possibilities of risks or complications that may result from the exercise training, bagat mga minor laba joint or muscle stiffness. Minimum, yes. Bagat gina-assure gyap naton it confidentiality hit data nga mako-collect kini nga study. Moving on to possible benefits for the participants. The study's findings would aid respondents ini nga aid baral yun pa by providing them with information about the impact of exercise and vices on one's health and their attitude towards their role on health promotion. So, it benefits namon actually kay new knowledge ang mula tam para era. Tapos pwede gyud ini maka-help in new findings para physical therapy practice. Pero para participant, knowledge lang, ma'am. So, signature of research participant or legal representative, di naka-enclose na na-understand niya it mananabuha iya nga na-understand gyap niya nga anot mananabuhi ni nga research study. Tapos printed na yung participant. Tapos kung applicable, legal representative, signature date, contact person. Should you have questions regarding this study, you may contact Kaizi or Princess. So, ito ma'am, na-include naton nga tanan niya elements of informed consent.
Okay, ay lang ipagkuha. So, balik kay Igbaw. Again, the way you address it should be more personalized, diba? More personalized.
Ma'am, excuse me, ma'am. It more personalized, ma'am. Maya kan nga kuan, I understand. So, kadito?
Dire, masaring ka. Ibaga nagkukuang ka, naghahatag kan letter haiya, ito nga participant. Nga hiya light mabasa. Oo, masing ka. Iti mo ikaw, amon gin choose nga participant kay ko the best nga sugadhini, and so on. So wag nangunguyab ka. Tapos, and again, when you say you have to, okay lang title, kasi title mo ito hiya. You have to simplify pa an impact nga term ng vices. Ang vices, what is vices? So, pwede ka magputang hanin purpose ng kada study. The vices means sugadhini, and so on.
Okay.
Oo, bagat. Para at least ako nga ni, kung dili kito maaram vices. Siyempre, ang tao, nga tataga ni mo, feeling lot niya maaram, hindi yung question kay mami niya maaram niya. Pero di nga niya maaram. So, para klaro la. Anyway, when you write a concept for informed consent, imo magapit tugin to test. Tataga mo iba-ibang tao, papabasa mo era kung naintindihan nila. Iba-ibang tao tim tatagan, maray ara, may ara, magkarit, waray hindi rin magkarit nga tanan nga type nga tawag ko kung ni may hatag ni Matera at papakita ni mo kung naintindihan nila. So ano pat mga change pa nila. So okay to, naging butang niyo kinahanglan ang conduct study, mag-aano hera, respond will be answering questionnaire, prepare by licensed person, undergo a 5-week duration of exercise training. So mag-exercise training hera ano. So,
yes,
and also, so ang terminology as well, importante ako nga, ang terminology is very simple, nga understandable, and also ang EU benefit, Pagkanta daw ang benefit ng part. Okay, pwede gap niyo, di ba nasing ka nga knowledge. Okay, gaining knowledge, pwede gap itong, mula ngay, benefit. Okay, so pwede niyo baga paupay-payong pa niyo. We may gain, will have a gain knowledge, magkakalat ng knowledge, and then we will actually impart it to you. O kumbaga, ipapasabot ng haiyo para mahatagyap kamuhin, matagangyaperahin knowledge nga and also kumbaga ano matiyo ni kagagawsan ko nga training, di ba? Mga training. Pwede ka pa another benefit is also exercises. Tagan mo heran personalized nga or individualized nga exercises kasi you are all physical therapists or free exercises or free treatment plan or free exercise plan para era kasi these are tawagin ni mga tawag ito mga obese overweight o gidi dot obese baga overweight ganda marupet pa matiyot overweight.
Yes ma'am, may ma-offend.
Ma-offend ito no obese. Okay, so dito pwede ka pito additional nga benefit
mga incentives.
Oo, tatagan heran treatment plan or personalized nga plan or individualized kumbaga from us, physical therapists. Kasi ma-add ko kamat niyo, iti participants kasi ma-evaluate man niyo tagusa-usa. Hirat para hirat. Kasi magkakandak ka mo history taking and so on and so forth. So baka may ito nag-conduct gihapon abo ka mo ito nag-conduct baga initial evaluation. So marap ka mo kung ang best na iyang exercise for pwede gyud ito nga benefit. So kung mag-impart la ka mo knowledge pwede gihapon. So kung mag-gain na knowledge dapat mayakan ka mo nga okay ano man amon result ng study makasabot ka mo which is pwede gihap niyo mahatag ba mas mahatag nga ibang tao. Okay, so pwede ito yan. So again, dapat ang pagyakanla and also the use of terminology. Puros ba niyan tiyo katapusan nga ay, pero aniyo hini, ang katapusan which is the informed consent part na ito hiya. An iya pag consent na good, ito nakabutang ay. Okay? Pero andito nga part ha igbaw, dapat ikaw na mo nakuha kay kawit-kuan so ganin baga ka naghimon letter para iya la mismong tao. Okay, so there are more generalized nga information amit at panguyab ito sa nga participant. Oo, panguyab para ka mag-invite ka hinda mo nga tao. Amo magud ito tatong purpose. Okay, thank you. What I'm minimal unrest and discomfort minimal man ano. So na-inform na iyakan mo gihapon ko ano ang joint and muscle stiffness po. Okay. So ano man ito gihapon if there's inconvenience ano man timbubuhaton. Pakibutang gihap. So if there's a possible joint and muscle stiffness, so ano timbubuhaton na sa PT, ano may mga standby ka nga mga ice. Okay? Icing dayon, ano ba ito if whatever but butang dida kung mo immediate treatment or sinisiring first aid. Pag nga papag-inkaon mo ito yung patient nga tera balay. Maray mo labubuhaton. Ano malalim tagan naman lahim pa paglasan na niya pain if ever magkadang pain. So dapat ready ka ito nakabutang ito dida. Okay, thank you. Thank you so much.
Thank you, ma'am.
Welcome. Okay, next. Rosales. I'm sorry, Batan. Kamo, sige. How about Rosales? Okay na niyo?
Wait, ma'am. Try ko daw, ma'am.
Sige, anay, Ralpha, madali lang. Sige, try, anay.
Nakikita na, ma'am.
Anay, maray pa. Sige lang. Ay, na-load pa.
Di pa, ma'am, nakikita.
Adi na. Nakita na gihap. Thank you.
Yan. So, ma'am, amon, ma'am, bagat
Anay,
kuan. Itsura ang amon.
Kuan da por na ko daw anay. Kidik nakita. Kidik nakakabasa. Wala ko nababasahan.
Actually, nadad ako kay naka-PowerPoint.
Naka-PowerPoint niya. Okay. So, pwede matiyag kuan na niya. Oo, niya size. I-change daw kung i-move laan iya. Hindi ha bottom mga part.
Ito, ma'am. Nakikita, ma'am.
Ano ba yung na-load pa? Sige daw, explain lanay ka mo. Sige, bayan lang na-load pa kasi. Hindi ako sure. Actually, yan na nakikita ko na siyahan, maging percent para siyahan. So, kita nakikita didi. Pero dire pa kumitan any changes. So, sige, padayon lanay, explain lanay.
So, but ma'am, and first, ma'am, but gin title which is like improving movement quality of clinical practice. So, pagdating sa study aim to investigate how physical therapists experts promote movement quality in their usual clinic setting. So, the paragraph is ginaano naman ang participants na we appreciate your interest in participating in this interview have been invited to participate as you are like therapist, please read through this information before agreeing to participate if you wish to by ticking the yes box below. So, the next naman, ma'am, is like gin-inform and participants na you may ask any question before deciding to take part, like conducting the researcher. So, is the principal research
Nawara. Halika, Roman, nawara. Okay. So, anira iba nga awan niya iba nga kagrupo, managbanag, waragyapan, anira di pa managbanag. Waragihap, managbana, o adi naman, bumalik naman. Kay Kala Rosales, Kasilan, pangimida mas.
Okay ka lang, Jacob?
Hello? Sorry, ma'am.
Kasilan gihapon, maluyat ito signal?
Ma'am, patagras kami internet.
Kino ka mo nagkagrupo? Pwede yung taman usay ramang mahiyo,
Ma'am,
mangkurkusog.
nakikita naman.
Nagkagrupo mo yung mga internet.
Balit, dapat may mas
Ma'am, nakikita na, ma'am.
Okay, to klaro na ito ya. Klaro na.
So, next, ma'am, bakit we appreciate your interest, bakit gini-encourage ba ang participants participate na amo, like you've been invited to participate as you are a licensed physical therapist. Please read through this information if you wish to by ticking the yes box below. Like may kita magpipili mo makalium na may yes, I agree to take part. So, and next, ma'am, is you may ask any question baga mo gini-inform participants na before taking part of an amon research study, but you may ask any questions before deciding. Ayun, ma'am. So, bagat amon dili gini-inform na the principal researcher are second-year students who are attached to the physical therapy department or Remedios Trinidad Romualdez Medical Foundation. This project is being completed under the supervision of their research advisor and in collaboration with the physical therapy department of the school. In-depth interviews are to be conducted with a semi-structured interview guide wherein we will invite you to simply describe what you have experienced as an intern and what successful therapeutic processes for promoting movement quality have you learned for your experience. Each interview is to be audio taped and transcribed. This should take no longer than about 15 minutes. No background knowledge is required. Bakit amo na din inform and participants. So, and first naman din is, do I have to take part? No. Bakit gino-note naman and participation is voluntary la. So if you do decide to take part, you may withdraw at any point for any reason during the should you be uncomfortable with the questions, you are allowed a prefer not to say option for each set of questions should you prefer not to answer a particular question. So next, ma'am, is how will my data be used? So hindi na makukuha na amon makukulit na data is we will not collect any data that could directly identify you. Kumbaga, hindi naman makukuha ang confidentiality. So we take all reasonable measures to ensure that the data remain confidential. The responses you provide will be stored only in the personal computers of the researchers and may be used in academic publications, research data will be stored only for the entire duration of the study. So what page naman, ma'am, is bagat gingo ka na who will have access to my data. So pag in-explain naman din na under researchers, under advisors, process your data for the research outlined above. Research is a task that we perform in a public interest. We would also like your permission to use the data in the future studies and to share data with other researchers. Data will be de-identified before it is shared with other researchers or results are made public. So, ang next naman is whom do I contact if I have a concern? Bagat di ma'am part, maging bagat if my concern hara on study, please speak to ang mga researchers in friends ka manibana ki Aubrey as ako or their supervisors, which is ikaw, ma'am, Mrs. K. Sudario, and we will do our best to answer your query. We will acknowledge your concern within 10 working days and give you an indication of how it will be dealt with. So please note that you may only participate in this survey if you are 18 years of age or over. Kasi bagat may dali di ma'am bagat box na bagat yung ko na yun sa certify na 18 hiya. And then if you have read information above and agree to participate with the understanding that the data, including the personal data, you may submit will be processed accordingly. Please tick the box below the start. So, and may box ihap, which is ang kanina na ako na-discuss na bagat they are if they're gonna take part hand study. So next is amo na din ko ma'am like signatures hand
Okay,
person
sige.
taking tapos hand participant.
Okay. So, this example, guys, depende ni mo participants. So, this is very specific. The participants are all licensed physical therapists. So, anyway, the terminology is okay because if in terms of education attainment, mas ma-understandable in yung mga licensed physical therapists. And now, what's the benefit here? Na-mention yung benefit. What's the benefit of me participating? If I'm a physical therapist, I'm one of your participants, what is my benefit?
Ang benefit namin in an participant ma'am is additional knowledge, which is iyayakan namo niya when bagat dito na part ako ma'am
A questionnaire.
like yes ma'am.
Okay, you may also add here the benefits. Gihapon, mas marupay, mas
Yes,
klaro. If there are any risk, may risk and discomfort ini. Ano ini nga mga risk and discomfort may da? Or
Wala
mga-
so far ma'am.
Okay, so kasi ni mo interview here is what do you call this? Experience as an intern and successful therapeutic processes for promoting movement quality have you learned per your experience?
Kay voluntary man lagi up ma'am ang pag-question ma'am. So bagat
Okay, kasi
like if there is
okay, so and ako lang kasi concern is in terms of the risk and discomfort, especially discomfort, the content of the questionnaire. Di ba? The content of questionnaire. So, di
Yes,
man
ma'am.
iduro ka personal. Oo, di man iduro ka personal.
nakabutang man gyud dito ma'am amon consent ma'am na bagat voluntarily lang ma'am like if dire na ra gusto ig-answer ang question pwede man ma'am dire na ra ig-answer.
Okay, so pakibuta. Oh, yes, okay. And the age. Kano kailangan age? Na 18. Malay mo, kano 18. Di pa na eskwela pa inin. Na license na yan, na eskwela pa yan. Di ba usually pag licensed physical therapist ka na, di rin natira below 18. Kino kailangan butang pang 18 years old? Puro na rin mga, nabinaya na, mga lagas na ka mo mag-graduate kasi hindi pa ka mo senior high nga, duha nga years. So mga sugod na hindi ang bagat common sense, they're all above 18 years old. So do not put age, or I don't think you need to put the age kasi nera mga specific kaniyo
Balik ko naman
accelerate. Specific kasi, licensed physical therapist, so don't need to put age. Wow, mas itong mga pisit, wow, underage pa ngayon ako. So, yun lang. Ang terminology is okay kasi naintindihan ito mga based on the education attainment which are the physical therapist license, pero maintindihan ito nila nga mga terminologies o mga language na yung ginhatag, yung butang dito ni mo informed consent. So, yun lang. Benefit lang. Pakibutang kasi age, pakikuha. Sige, next.
Yes, ma'am. Yes, ma'am. Thank you.
Yeah, thank you so much. Lahara niyo, Vergara. Ano yan? Lahara nga ni Vergara? O, di manikay. Okay, so, Vergara, ni?
Yes, ma'am.
Okay. Sige.
Okay, ma'am. Ang namang topic po is the effects of treadmill training in chronic hemiparetic, a randomized double-blind clinical trial. The purpose of the study and naka-indicate is this study investigates the effects on motor function of the paretic lower limb when a load is placed in a lower limb that is not affected by the paretic condition. The procedure, the volunteers are subjected to a total of 12 sessions, which are held twice a week for 6 weeks. When walking on treadmill, the experimental group is required to wear a shin guard on the unaffected lower limb and to bear a weight of 1 kilogram for women and 3 kilograms for men. For 6 weeks, the participants in the control group will receive conventional treatment twice a week. A sling was placed around the upper limb of patients who are unable to support both hands on the treadmill due to their deficits to avoid compensatory movements. The participants are allowed to take 1 minute break if they felt it was necessary, but the total time of the 20-minute walking training did not change. The final evaluation post-treatment is carried out by the same evaluator at the conclusion of proposed sessions, and the follow-up is carried out by the same evaluator for 45 days after the conclusion of the sessions. The risk and discomfort, we intend to conduct a one-on-one interview with you regarding your demographics and personal information at whatever time is most convenient for you. If you have any concerns about your preferences or comfort, please let us know and we will do our best to accommodate your suggestions. Furthermore, you are not required to provide any explanation for failing to answer a question or refusing to participate in the research.
So, Adilot and benefits. So, with your cooperation in this research, it will be used in the ongoing research about the people with CVA who have low physical fitness and worsen their cardiovascular health due to the decrease in their activities. Through this research, it will be beneficial in the work field of the doctor in neurology, as this discusses and provides up-to-date information. So, confidentiality liwat. All data from the study will be coded to safeguard each participant's anonymity. To protect the subject, no names or other personal identifiable information from the subject will be used while discussing or reporting statistics. To avoid unwanted leaking of personal information about the subject, all files and data guarded by the investigators must be securely stored. Only investigators or research personnel will have access to the files and data. The data will be destroyed once it has been thoroughly analyzed. So nga diliwat request for information. If you have any queries about this study's participation or information, feel free to contact Ralph, Christian Sibatan, Peter P. Sorbatas at any time to ask questions and discuss your concerns about the intervention procedure.
All right, folks. For the refusal or withdrawal, you may engage your participation at any moment without charge if you feel the need to stop or if you are uncomfortable in any way. And for number 8, injury statement, participants in this study will incur no cost because of their participation. If you're incurred medical expenses because of participating in the study, the researchers will reimburse you. And for the 9, consent statement, by signing this form, you accept the use of disclosure or the following information for this study. I authorize the use of my documents as well as any observation and conclusion obtained during this study for educational, publication, and presentation reason. And for the signatures, the name of participant, name of witness, and person obtained consent.
Okay, thank you for that. Ayun, ipagkuhaan niya. Okay, and for that, yes, again, your tawag ito, the way you address or write should be consistent, ha? Consistent kasi and siyahan baga diri baga good okay. Tapos and also terminology again, what are your soon to be participants? Are these stroke patients? Are these stroke patients, right? Siya ba ini? Paratic. Siya na, no?
Yes, ma'am.
A stroke patients. So these are mga possible stroke patients. So again, cognition could be a problem. Pero pag-intindi is a problem. So again, terminology must be simplified. And then for the wrist and discomfort, so nagbutang man kamo didahin gihapon kamot mabayad. So in case nga, paki-elaborate lang more kung in case may kada injury, may kamot mabayad. Pero actually, ang patient ay mabayad, ma-reimburse pa kami. Amo niyo dinibutang. So mabayad talaga ang patient anay, tapos ma-reimburse. Okay lang ito, at least klaro kami ito. Tapos ang iyo, dito wrist and discomfort, may wrist and discomfort ka man. Okay man yung confidentiality, although dapat consistent lang yung pag-address ha, abisin ko pa iyo kanina. And the rest of the group nga, it should be more personalized nga paghatag, pag-address sino sa nga tao. Tapos, demographics. Okay, ito nga demographics, you have to elaborate kasi some people do not know what is demographic.
Apo.
So, you have to elaborate, conduct one-on-one interview with you, and we're going to ask your age, the specific gender, and so on and so forth, address, personal information, whatever. Be specific na lang. Kung ano't nga butang ito, sorted nila kung ano't nila nga mga demographics na yung kukuhaon.
Apo.
Tapos, if you have any preference or comfort, please let us know if you're not. So, any risk like matutumbahera, matutumbahin yung patient, there's a possibility matutumbahin nila while they're doing these activities. So kung bakit klaro ito kasi it could happen. So kung in case of injury, so what are the what are the possible risks? So ibubutang niyo, i-discuss it niyo, anong possible risk? Ano pwede hindi ma-risk ito sa mga tao? Ano pwede matutumba ba niya? Ano ba niya? Tapos kung if they're not uncomfortable, ano ito yung procedure? Papag-anuhan mo niya patients?
Kuan ma'am.
Papag ano niya, so duha ka grupo.
Walk ka treadmill.
Yes. Tapos, any nga shin guard, what is this?
For protection lang ma'am.
Okay, so you have to be specific kasi kung ibang tao mas anong shin guard. Okay, so this is kuan, wrap lang hiya, hayutiil. So unaffected lower limb, that's very tawagin ni that's not a layman's term kasi ano unaffected, what is lower limb, di ba? Ato ito terminology. So dapat ito hiya kuhaon niyo be specific. Okay, bear weight. Okay, nito maintindihan Matia for one kind so tapos okay, so papag-walk mo treadmill. So there's a possibility of injury. Okay, so okay, kung ito yung clarity your wrist and discomfort. And so it could be one of the injury at pwede matumba. So matumba ni mo patient. Okay. Okay, this is a present tense. Okay. Sige, but amo na ito. Amo ito usually tapon baga ko ni okay mat-iyo basta consistent lang. Tapos and also the terminology. Kasi na-depende ito iyo participants. If your participants on stroke, be mindful that stroke patient might have a cognitive problem. So, di na nakakaintindi. Tinginakan. So, bisang pathira baltuk-baltukan, pero nira problem anira tungod na stroke, nagkadahira na cognitive problem or cognitive difficulties. Nira cognition. So, dapat very simple terminology. Tapos, pwede ka mo mag-add if you do not understand what I'm saying now, kung ano ito yung bubuhaton niya na, you can ask someone with you nga maistoryahan namon. So, it's someone with you that you can trust nga amo ni istoryahan. Kasi di matapod budayon na imo, labi na kung di nakakaintindi. So, titinangalat hiya mo. So, sugad nila ito. Pagbutang nalagap ka man sugad dito. So, okay. Thank you so much. Tapos, and next and last, Nira Inverso, Ramas de Miguelio.
So, hello po, ma'am.
Yes.
Present now. Nakita po, ma'am?
Yes.
Okay. So, good day, everyone. Here we can read Informed Consent for Participant of Frozen Shoulder Interventions, a Comparison Study. So, in this part, we can mababasahan natin ang project team members and also the project manager. So first, the purpose of your participation in this project, you are invited to participate in evaluating and comparing various interventions of frozen shoulder, mainly involving methods such as corticosteroids and physical therapy. Procedures, you will be asked to perform a set of tasks using the interventions, corticosteroids, medications, and physical therapy measures, such as exercises, modalities such as transcutaneous electrical nerve stimulation, ultrasound, low-level laser therapy. So basically, in this part, it illustrates what the participants will be up to. So this task consists of taking corticosteroids medication during the most painful part of the condition. Tapos, as you perform various tasks, your progress and comments will be noted. Thus, the evaluation session will last no more than 4 hours, with the typical session being about 2 hours. The tasks may be tiring, but you are welcome to take rest breaks as needed. If you prefer, the session may be divided into 2 shorter sessions. So here, risks, side effects of corticosteroids, like what we have mentioned in the procedures. So side effects of corticosteroids, brief pain after injection that will last for a day but will be relieved with ice packs and cryotherapy and facial flushing. Fatigue and pain during and exercises in the beginning due to nature of the condition. So benefits of this project. Oh, wow. Your participation in this project will provide information that may be used to improve our study of frozen shoulder. Participation allowance would be recompensated. You're requested to refrain from discussing the evaluation with other people who are not involved with the study. Alternatives to participation. The research provides tight scheduling of aerobic strength strength, balance, and functional training interventions and intake of corticosteroid medications, which would persist for 12 weeks with 2 to 3 home visits from physical therapists a week after a medication period. If there are unexpected problem encounters along with the procedure schedule, example, unstable home setting, researchers will provide a clinic where interventions will be held and will also provide the means of transportation of the patient to and from the patient's house to the clinic. At the extent of anonymity and confidentiality. The result of this study will be kept strictly confidential. Your written consent is required for the researchers to release any data identified with you as an individual to anyone other than personnel working on the project. Personnel. The information you provide will have your name removed and only subject number will identify you during analysis and any written reports of the research. The session may be recorded. If it is recorded, the recordings will be stored securely, viewed only by the project team members, and erased after 3 months. If the project team members wish to use a portion of your recording for any other purpose, they will get your written permission before using it. Your signature on this form does not give them permission to show your recording to anyone else. So request for more information with regards to the participation information of the study. Should you have any questions, you are free to ask and discuss with Floral C. Inverzoda team manager at any time of or part of the intervention processes. So, yeah, pwede get beforehand intervention talaga. So compensation, your participation is voluntary and paid with participation allowance as well as medical health care benefits during and after the trial. So like what we have mentioned. Freedom to withdraw, yes, you are free to withdraw from the study at any time for any reason. So injury statement, there is no expense for participating in this research. The researchers will compensate for any medical expenditures resulting from participation in this study. Approval of research, this research has been approved as required by the institutional review boards for projects involving the human subjects at RMF. Participant responsibilities and permission. I voluntarily agree to participate in the study and I know of no reason I cannot participate. I have read and understand the project's informed consent and conditions. All of my questions have been answered. I acknowledge the foregoing and provide my informed consent to participate in the experiment. If I participate, I have the right to withdraw at any moment. I agree to follow the project's guidelines. So, my box actually kami didi and the structure got ruined pag PDF. So, on signature, here we can read if the na-seal talaga ang deal, name of participant, contact phone or email, signature date, and witness of signature. That's all po, ma'am.
Okay, dapat importante yung signature niya.
Amo lagi, ma'am. Nag-upa.
Okay, so far okay naman, pero ano kayo benefit, out niya yung allowance? Dakit.
Monetary ko no, ma'am.
By the way, ano yung participants? Sino harahin yung mga participants?
Base kasi ma'am inihan PICO activity ni Miss Inverzo. So anamon participants kay patients with adhesive capsulitis at grade 1 and 2.
Grade 1 and 2. So any age
yes,
group.
Ma'am. Yeah,
as long as there is adhesive
yes,
capsulitis. Okay, so again, anyway, undergo man inihiya hiton terminology, it should be more simpler lahiya. Ayun yung, ay kabugpian mo mga mag-upay nga words kay dito yung mga participants usually is di rin man itong hira magkarit. Di rin man itong ngano sa di kung ako't mabasa tapos syempre so feeling like na kung maaram ako. Pero hindi ngayon. So kailangan talaga tiya. Tapos ito paki-explain inihira nga mga kuan nga corticosteroids, ano ito hira, and then what are the physical therapy measures in hira, ano hira at mga gamit, pwede kapit ni explain further. So anyway, in this mahatag mo nga yung patient, pwede ka mag-iawa participant, soon to be participant din, pwede ka mag-explain, ma'am, pwede mag-explain ka kung ano tira nga mga measures, kung may question. So, kasi di rin magkita, any age group may hira. So, simple, and also malay mo to sa nga participant, soon to be participant, maaram na iya kung ano ito yung mga measures niyo or treatment at ibaliwat diri. So kung may mga pakyan na ma'am, may pakyan in terms ng mga measures, pwede niyo ito pakyan na amon later after niyo pagbasa. So ano to, may hinabo fatigue. And fatigue, dapat may dakamuhan fatigue. And fatigue and pain during and exercise in the beginning due to the nature of the condition. fatigue and pain during and exercises. Bakit hindi?
Before and during ito, ma'am.
Before and during exercise, ganun.
Due to the nature of the condition.
Okay. So, inibutang din hikon ano iyo treatment.
Okay po, ma'am.
Dapat, at least may daniyo kasi butang dili nga brief pain after injection, so may daka mo ice pack. So, ang fatigue, waray. Ang pain, waray ito ya. So, fatigue, anyway, pwede man hiya, magbutang ka mo, there might be fatigue or pain. Dito krogsingon, nga tanan ito nila ma-experience in fatigue and pain. Di ba kayo, depende man lang yung tao. Depende lang era tolerance. So, butang la ka mo might. Dito hiya nga, at mayakan ka mo nga, fatigue and pain talaga at era ito ma-experience. So, you might experience fatigue and pain. So, if ever ma-experience ka mo papag-rest ane ka mo, and then for pain, we will give you ice pack or ano ba, ibubutang. So, na-intriga ko iyo allowance. Okay,
Yes.
so anong allowance? So, kailangan, bahala ka mo. Daw mo na yung kwarta. So,
ma'am, okay lang ba? Like, di ba na-mention mo, ma'am, nga, ayaw lang ko no ano igyakan like and benefit. Okay lang kung magsugat.
I mean in terms of allowance?
Yes po, ma'am.
Kasi
Like,
yung
how many
allowance,
invite?
para ano ang allowance?
Compensate.
Para, what do you mean by allowance? Like, ang pagkadto, hain ka magkakonduct ni nga study, may niyo certain lang a place?
Pwede home-based, pero pwede if waray, may clinic gap, ma'am.
So, kung if ever may clinic ka mo, an allowance could be an era sinising transportation, be specific ko ng allowance kasi pwede ra anong allowance pagkaon, pwede niya para pagkaon na mo, para snack, para tamon transportation, kasi atira study, adia clinic, harayo amon. So dito, or if you're home-based lang yung iyo plano.
Yes po, ma'am. Home-based.
Be recompensated. You're requested to refrain from discussing evaluation of the people who are not involved in the study. The information that may use to input. So other benefits aside from this, an allowance, pwede mo na itikad to hiya diri itong benefit nga category. Pwede mo na tiya kadto compensation.
Yes, ma'am.
Compensation kasi di na mo latibutan pagkadto mo benefit in terms of the study.
Yes,
Ano yung outcome, ano yung study. Okay, amo to yung benefit. So, pwede kapito, like I said kanina, pwede tagaan niyo yung treatment and patient. Okay, tagaan yung exercises. Or any, mga precautions after ma-reoccur ang frozen shoulder. Kasi ang frozen shoulder, pwede mag-reoccur. So, any precautions or any treatment or exercises nga diriya mag-reoccur na. Pwede ito, another benefit.
Okay po, ma'am.
Okay, so thank you.
Thank you, ma'am.
Thank you. And that was the last group. Thank you. So di ba? Wala pang alas 12, tapos na kita. Thank you so much for participating. And your output, bisan na ito within this week, pakipasa ito ha, group chat. Ida-download ko la para may dako agad man output nga papakita na may daniyo output. Sige. Thank you. And happy
Ma'am, i-revise pa, ma'am.
Yes, paki-revise kasi ma-base lang pa ko ditohan aton. Iyo final grade, i-base ko niyo final output. Okay, so within this week para magamit niyo allowance. Basta within this week dire pa Sunday. Okay? Thank you for
Thank you, ma'am.
Thank you, ma'am. Happy lunch, ma'am.
Lagi magutom na. Thank you so much. Bye.
Bye, ma'am. Happy lunch.
Happy lunch also.